Great. So we wanted to produce some videos for you, and I really thank Mick for getting behind this. I think these are really useful learning tools. So we've split them up. First of all, I want to know a bit about pain provocation. And Liam, there's no gold standard in terms of a clinical assessment tool to pick up lumbar bone stress. And this is not through lack of effort. Early researchers thought that lumbar quadrant or single leg extension was going to turn out to be quite sensitive for picking up lumbar bone stress, and it's not. But in the individual, sometimes these are really helpful because they'll help us to understand pain, and they'll help us to track how pain is going. So this lumbar quadrant, a few important things here. One is to get weight evenly onto both feet. The second part is to make sure that you're standing behind the athlete and to give them some safety, some feeling of safety, particularly if they're sore. And I always warn them that I'm going to get them to stop as soon as they start to feel pain. So what I ask them to do is to stand with their arms at their sides, to rotate slightly and gently slide their hand down the back of the leg. And what I'm looking for, I ask them to do their asymptomatic side first. I'm looking for range of movement and confidence in the movement. And then I'm looking for reports of pain. And so they'll do their asymptomatic side and then the symptomatic side. And this is not a gold standard test, although, if painful, it'll suggest to us that those posterior bony elements of the spine may be implicated, and we should look into that more closely. So lumbar quadrant is really useful in those where they're a bit in that reactive phase where the bone is irritated, and we can see this is helpful if it's positive and restricted in range and painful. It really helps us to suggest to that athlete and their coach that we don't want them working in this sort of movement in sport. So that's where I would take that athlete out of extension skills in gymnastics or out of fast bowling, but I would give them some alternative things to do to keep them in sport. If we move on to this, the single leg extension, what we want to do here is to ask the athlete to stand on one leg, cross their arms. I'll stand behind the athlete to give them that support again, and I ask them to slowly move into lumbar extension. And before they do it, I just say, let me know if this hurts, and if it does, I'll support you and we'll come back up to standing again. Because again, this can be quite provocative in someone who might have some muscle spasm, that protective spasm that's overlying that lumbar pain. So again, not a gold standard test, but helpful to guide and help us to understand a bit about how something's progressing or how reactive it is or how important it is that we avoid those extension moments in sport.
So it sounds like you're talking to your athletes, especially if you're stood behind them the whole way through this test, which you mentioned about the importance of making them feel safe. It's certainly something I'm cognizant of. And also, people can cheat on these tests. And then we see it a lot where you may think they're bending backwards, and if you're only looking at their shoulders and going, oh, yep, it's going back, they're actually just bending their knees and their back is flat. And that's one of the things I'm often saying, with your knee kept straight and locked out, can you bend backwards? Because often if they're painful and they're young kids, they're very good at avoiding pain. And so it's just really looking and making sure you're doing the test properly.
Absolutely, yep, and that's great. If you look carefully, it can be really valuable in seeing a difference between one side and the other. And you can point that out to parents. Once someone understands that you really get them, you can understand their pain well, then that's where you're really building trust as a practitioner. So moving on, the next things that I want to know about hip dissociation, and the reason for this is I want to understand how well someone can move at their hip without moving through their lumbar spine, so they can hold that lumbar neutral position. Because that's what we're asking to do in sport in many ways, is to make the hip joint do the work. And what we do see in terms of patterns here is that we're not loading up the hip enough and we're excessively loading up the lumbar spine. So I like to use this 4-point kneeling sit back. It just gives me a bit of an idea as to whether if someone flexes their hip joint, do they always flex their spine as they flex their hips? And this is important in those flexion movements like rowing, for example. Is someone working through hip flexion and lumbar flexion together, or can they separate those? Can they use their hip joint really effectively in flexion? And then I guess the next thing about that is if I ask them to do this movement and then I'm going to correct it, and to see whether they actually can correct that movement pattern. And it's really interesting sometimes when high performance athletes and expert movers like gymnasts that you think should be able to very easily achieve something, they really can't. And that gives me some really good clues that we need to work on that as part of our management plan. The other thing that I look at, the next thing I look at really when I'm wanting to know about hip dissociation, but also a little bit about the way that those extension muscles work is prone hip extension. So first of all, I do this actively. So I ask the patient to just lie on their tummy, flex their knee to 90 degrees and actively extend their hip. And it's normal to get lumbar extension as part of that hip extension. But what I really want to know is, can they get some hip extension without lumbar extension? So the next thing I'll ask them to do is, cue in their abdominals a little bit, or hold their lumbar spine stable. And you can use a whole lot of different cues as that. And I think physios are pretty good at that, and see whether they can isolate just that hip extension action. And the third part of this test is that I like to come in and then passively ask the athlete to completely relax, and I'll passively extend the hip while stabilising the lumbar spine. And what I'm looking there is, have they actually got the hip extension range available to be able to do that?
And it looks like from the video there that you've instructed Mick to place his hand on the patient's back. Is that how you're stabilising that? Is that just a sort of a cue and reminder?
That can be a cue and a reminder. You can do both. I will first cue to see whether the patient can actively do that, and then I will do a passive hip extension where I will test them through range. But I'm really much more interested in what the athlete can do themselves. Yeah. So hands-on cue is probably my second port of call. The first thing is to see if they can do that themselves and find how to get hip extension without lumbar extension. So I guess the next test that I've asked Mick to show us is lumbopelvic stability using active straight leg raise. So what I first of all ask that patient to do is just to lie supine and actively move into hip flexion with a straight leg. And what I'm looking for there is what happens at the pelvis. Are they getting... So an athlete should be able to do this with a stable pelvis. Right? And what they do is they actually use their abdominal muscles from above to hold that pelvis stable while they elevate one leg. And if we think about this for, say, someone who's kicking in soccer, what we want them to be able to do is kick with a stable pelvis above, and that'll help their performance. They'll be able to kick harder, but they'll also kick without rotating through the lumbar spine. And so what we do first is ask for an active straight leg raise. Second is to cue a stable pelvis, repeat the motion, and the third would be to give a bit of resistance and to see whether they can perform a loaded straight leg raise motion and with a stable pelvis. Yeah,
and I think that sort of reminds me that whenever we're looking at athletes with lumbar spine pain, you've also got to think about the close relationship that you're mentioning with the pelvis. And so you're screening the sacroiliac joint, you are screening the hips, and is this actually a case of referred pain? And we're starting to look here, this is the beginning of potentially where the clinician brings in a battery of SIJ tests to clear that, and you mentioned the hip as well, and so I think that's also important for individuals to consider.
Absolutely. So yeah, encourage physios to be really aware of those Laslets tests for a sacroiliac joint, which is a whole group of 5 different tests that can, they're all pain provocation tests that help us to understand whether there's pain with the sacroiliac joint as a sort of a main source of that pain.